Hi everyone, welcome to another segment of the Right Way Wednesday. Today we're going to be talking about the use of standardized assessments in speech language pathology evaluations. My name is Rinki Varandani Desai. I am a speech language pathologist with Health Pro Rehab, currently working at the St. John's Home in Rochester, New York. This is just a little bit about me, and thank you so much to Nicole Clark for this invitation and honor to be bringing you one of these Right Way Wednesday videos to all of you today. So let's dive right in. Why do we need standardized assessments? Standardized assessments are empirically developed tools with statistical reliability and validity. They are objective measures that help us support the value of the services we provide so we can ask for reimbursement for what we're doing with our patients. They give us a universal language and consistent way to document the presence and severity of impairments and also help establish a baseline for our patients at the time of assessment. Most of us work with dysphagia, and we must use a standardized objective assessment of swallow function. The test that I would recommend, in case you're not familiar with it, is the MASA, the Man Assessment of Swallowing Ability. It consists of 24 clinical items for evaluation of oropharyngeal dysphagia, which we have to rate. So we have to rate the patient's performance across a series of these different swallowing and some non-swallowing tasks. And the most important thing is that when we arrive at a score, we have to use that score to identify what impairment the patient has or the degree of severity of the impairment, assign a diet recommendation, and most importantly, state what that score indicates. So I think that's something that some of us might forget sometimes in our narrative, where we might say patient presents with a MASA score of 148. But what does that mean? The next clinician who picks up our evaluation or somebody who audits our evaluation should be able to immediately interpret the meaning of that score. So if you get a score of 142, you can say that indicates the patient has moderate or moderately severe oropharyngeal dysphagia, a moderate risk of aspiration, and hence the diet recommended is, maybe a mechanical soft diet with nectar thick liquids. You can use the MASA for your standardized assessment section in your plan of care and then supplement that with subjective information in the form of a clinical bedside swallow exam. You can use the Yale Swallow Protocol, the SAFE, which is another standardized test for swallowing, or the FOIS, the Functional Oral Intake Scale, to supplement the MASA. And of course, whenever appropriate and available, we should make use or referrals for our patients for FEES and VFSS exams, because these instrumental exams help us identify the underlying physiological impairments that contribute to the dysphagia. Moving on really quick, another big domain that we assess as speech language pathologists is cognitive linguistic function. I think most of you might be familiar with the MoCA and the SLUMs. So these are standardized screens. And I know a question I have gotten very often, and Nicole gets too, is that what other tests can we use to supplement the MoCA and the SLUMs? So in the interest of time, I can't go over what each of these tests do, but a simple Google search should help you pull them up. You can order these tests. So for primarily cognition, the cognitive component, the tests I would recommend and that I frequently use are the RIPA-G, the Ross Information Processing Assessment Geriatric second version. You have the CLQT, the Alpha that I really like, it's really functional, the FLCI, and the ABCD. And for those of you who want to assess your patients with impairments that are more heavy in the language domain, you can use the BDAE or the Boston Naming Test. You can use the Western Aphasia Battery. That's one of my favorites. I use it. It's my go-to test for anyone presenting with aphasia. And then you have the FDA and the ABA for patients with dysarthria and apraxia, respectively. I just threw this slide in there because sometimes we just don't have the time to complete an entire standardized test battery, and sometimes we just have very low-level patients. They may not be able to give us the time and attention or participation that we need to complete a standardized test. The bare minimum we should be doing is staging their impairments and dementia. So you can use the brief cognitive rating scale along with the GDS, the Global Deterioration Scale, to just provide a number from 1 to 7, stage the dementia, and again, indicate what that score means. So if you say patient presents with a GDS score of 5, indicate that that means that the patient has moderately severe cognitive decline, which indicates a moderate level of dementia. Before ending the presentation, I only had a few minutes, so I just wanted to, reiterate some important points. Um, we have been told to use the mocha and the slums as often as we can. Like I said, you have a range of tests you can use to supplement the mocha and the slums and your massa for swallowing to really make sure that your assessment is standardized, is consistent, and most importantly, I really want to reiterate this, what does that score mean? So make sure you are really elaborating the meaning of that score, irrespective of the test you use, in your narrative, in your progress notes, in your updated plan of care, and always mentioning kind of what that means for the patient and their impairments. The aim of a standardized test is to use the data obtained by the measure to frame your goals and plan of care in the best and most meaningful way possible. Thank you so much to the entire team at Health Pro for giving us access to a fantastic resource like the Documentation Success Facebook group. Asha will also be your best friend. They have some amazing resources. They have the practice portal, they have documentation guidelines. So make sure all you SLPs are really using Asha templates and resources to improve your documentation and your use of standardized assessments. Thank you so much for listening. Feel free to email me at rinkyslp@gmail.com. I hope I can contribute again to the Right Way Wednesday series. And I'm just leaving you SLPs with a little something. Looking forward to seeing who can identify what this means first. So thank you for listening, and looking forward to all the other Right Way Wednesday videos coming our way. Thank you.